Good morning, students. I am Yogesh Patel, Assistant Professor, GRY Institute of Pharmacy, Borama. So today I am going to cover chapter number 11, Autocoids, only because of most of students have gone through their NSS camping. So due to this, I am going to elaborate such types which is nearby completed in absence of those students who is a part of NSS camping. So before us starting, uh, let you all know that about what are the autocoids. It's background wise. So auto and coids means auto means self generation of some sort of plasma and serum based chemical entities which is synthesized in our body and also have most of the physiological functions to cover inside the body. So, chapter is also digniting the physiological role of histamine, 5-HT, and prostaglandins, and classification, clinical uses, and adverse effects of antihistamines and 5-HT antagonists. So, basically, students, you all know that histamine and 5-HT, those are the specific amines produced inside the mast cells, and they're gonna released inside the bloodstream when they needed in a nominal quantity. If the quantity arises, they may be responsible for the allergic responses of the body, or maybe a higher stimulus sensations that is arised inside the body or outside the body. So those concepts are in vitro and in vivo based. Prostaglandin is also the sense. So we are moving towards the slide based material. So if we are talking about the autocoids, so auto and coids is come of a Greek nomenclatures. Autos means a self and a cause means to cure, to remedify, to get the treatment on that. These are the organic endogenous molecules, means I already said that they are lining the plasma and serum chemical integrity of our body with its specific pharmacological actions in the middle quantity, in the medium quantity. You are not going through its excessive quantity, you are not going through its nominal quantity. You need its specific medial quantity to get that pharmacological effects. So these are two important amines. Along with these two, heparin is also synthesized and secreted by mast cells. So actually, mast cell is a retentive part of connective tissue, which is a blood. Although, okay. Apart from blood, these are also found in the smooth muscle tract of all the gut, GI mucosa, okay, lungs mucosa, sera, which is covering the lungs extrafacial cavity. Autocoids are chemical signals produced by different cells of the body, already talked about. They act locally at the site where they are synthesized and released in response to the external or internal noxious stimulus. Autocoids are chemical substances that are produced within the cells and are released in response to different stimuli and cause various physiological actions. I already talked about in my previous talk-ups. Moving to the next topic, which is totally based on histamine. Histamine is an organic nitrogenous compound involved in the local immune responses, communication, as well as regulating physiological functions in the gut and acting as a neurotransmitter for the brain, spinal cord, and uterus. So, you all know that the histamine is specifically involved in the sleep and wake cycles of the human body. As a part, a person sleeps at a specific timing limit and wakes up at a specific timing limit. That is the sophisticated arrangement inside the brain, which is nominally maintained by the histamine. So most of the immune responses are based on that tact, that if immune responses are higher inside the body, so there will be a extended count of WBC inside the lymphatic per count. So When there's a specific count increases of WBC in that lymphatic circulation, so the person may get the higher immune empowerment or maybe a higher powered immunity in that case. So, we already talked about the syllabus part, so you only need to read out its physiological roles. Okay, so I'm covering that physiological roles. So, first one is histamine play part in gastric acid secretion with the hormone gastrin. So, you all know that H2 receptor that is mainly agonizes the release of gastric acid from G cells, gastrin cells, which although you already know that then compensation with the H plus and Cl minus ions produced and released by parietal cell inside the interior stomachial lining. So that is the main H2 receptor which is responsible for the gastric acid secretion inside the stomach. Second one is histamine play important role as a neurotransmitter in CNS. Okay, so I already told that the sleep and wake cycles is maintained by histamine. It play important role in tissue growth and repair. Yeah. I already told that the WBC count in per lymphatic circulation is incremented by the histamine use due to the sleep and wake cycles. That is how the person gets a higher immunity when person or any individual getting his sleep and wake cycle properly. So there's a case where immune empowerment will be seized in that case. It also play important role in antigen antibody reaction. You already know that the most of the blood cell have the specific antibodies on the RBC surface. Specifically in the blood cell, I am only talking about or specifically talking about the RBC, which is having wide range of antibodies on its surface. So during the blood group determination or maybe the coagulation of the blood or maybe other factors which is working on the coagulability of the blood, that is mostly the Christmas factor is there. Most of the calcium entracement Ca2 plus plus ions are also there in that case. Okay, so these are all the growth and repair related functions. So if you are going for the repair, you need fibrinogen. In that case, calcium is stressing the fibrinogen to go out in the case and convert into fibrin. It also play antigen antibody reaction. You already know that in the sera plasma specific barrier sera, you found most of the antibodies entrenching the antibody antigen reactions is there. It is mediator of vasodilatation during inflammation, so it play important role in the recovery of inflammation. So I'm already talked about in the initial section of the slide progression that in the medial quantity you need only medial quantity of that all the autocoids you need to cover on that. So if you are getting physiological function of the histamine, there is a medium quantity of histamines produced and released by mast cell inside your blood. So moving on to the next topic, which is serotonin. It is along sophisticated amine released by the mast cell and also produced by the mast cell in the compensation. So along with histamine, serotonin is also the specific neurotransmitter, as a chemical that is playing a class apart role in the nervous system as well as the other body's physiological functions. Serotonin is a chemical that nerve cell produce and is send signals between nerve cells. So you are only talking about the presynaptic terminal and postsynaptic terminal, in between the space which is known as synaptic cleft. You are talking about that. So by the action of exocytosis, neurotransmitters get effected from the presynaptic terminal and that it is received by the receptor at the postsynaptic terminal to transmit the synapse of a single neuron onto the secondary neuron to get rid out of the sensory functionalizations of the body. Serotonin is found in many parts of the body like digestive. I already talked about the smooth cell or smooth muscle lining of or mucosa of the most of the organ which is lining inside the blood and throughout the GI tract. Also, it is a neurotransmitters playing important role in the central nervous system also. Okay. It also play a role in regulating mood. So along with oxytocin is also related from the posterior pituitary gland, which is also known as neurohypophysis in the sense. Along with oxytocin, which is also a mood regulating hormone, that case also playing a role to dilate the endometrium in the female side when baby is birth going to cease. So in that case, serotonin is also the agonist of oxytocin in this case, which is regulating the mood of the particular individual. Due to unwanted interruption, the slide or maybe video based presentation is blocked. Okay, so we are continuing that section. So I'm already talked about the 5-HT. What is 5-HT? It's actually a serotonin. So now it's turn to talk about its physiological roles of serotonin, in which first is cardiovascular system. It shows a complex action on CVS which depends on dose injected. So if you are going to inject a higher dose of serotonin, you are probably getting tachycardia, and if you are going to inject the lower or lesser dose of serotonin, you are definitely get bradycardia on that. So based on that, on smooth muscles starting it induces vasoconstriction but later induces vasodilatation. So vasoconstriction is a responsible criteria of incrementation in the blood pressure, and so as its antagonistic action is vasodilatation, where vessels gets dilated to get the blood pressure down. On heart, it induces a positive chronotropic effect, increases heart rate, and positive inotropic effect is also seen. I already told that if you are getting the higher doses, you must get the tachycardia or maybe increase in heart rate, and in the lower side of doses of serotonin, you are getting bradycardia, which is a decrementation in the heart rate. So on blood pressure, action of blood pressure is complex. It may be either cause hypotension or hypertension. So already talked about hypotension is a later measurement of the blood pressure, and hypertension is a higher incrementation of a blood pressure. Second thing is the smooth muscles. Smooth muscle is called as contraction of the intestinal bronchi and uterus. So all a tri section smooth muscle action is there. So smooth muscles of the intestine, where most of the intestinal cells gets located, a bronchi or maybe a singular unit if you are talking about bronchus, and then the uterus. So mostly these are action elicited by the serotonin on smooth muscle. Third one is a digestive system. It increases intestinal motility and induces emesis. Okay, so first intestinal motility gets increased by the peristalsis movement. If you are talking about the mass movements which is seized on the large intestinal area, and induces emesis. So emesis is basically induced by most of the sensation when traveling, when seeing such objects which is dirtiest in nature, or maybe it is a specific nucleus tractus solitarius NTF region, in which CTZ zone is located, chemoreceptor trigger zone, which initiate emesis to expel the stomach contents. Lungs, it causes contraction of the bronchi. We all know that if bronchi gets contracted, okay, so you must getting the emphysema attacks or maybe asthmatic attacks on that. It causes only on higher doses. If hyper doses gets less. 5 uterus, it increases the contraction of the uterus. So if the uterus gets contracted, the cervix has been also blocked due to the severe internal contraction of endometrium, myometrium, or maybe some of the things where endometriosis occurs. Sixth sense is the central nervous system. It regulates the sleep, mood, and appetite. How it regulates the sleep, mood, and appetite? Sleep is basically histamine's character. Also, serotonin play more major role. Mood is serotonin's specific effect, and appetite is also based on sleep and wake cycle, and as well as mood. Migraine is a half-sided headache where you are getting pain on half side of the head. Contraction and relaxation of brain vessel due to 5-HT cause repeated and severe pain because it has a specific action on mood regulation and also a happy hormone, maybe we can say that. And seventh one is allergic and inflammatory actions. It involves allergy and inflammatory reactions when gets acquisited on the higher amounts. I already told that these are the autocoids. It is basically needed in the body to exert the body's physiological actions. But one thing is there, you need its autocoidal content only in a medium level. If the level is rises, you are definitely going to get the antagonistic action of these autocoids. Okay, so that's it from the today's section. We are going to cover the next topic of the flight section. Till then, goodbye, have a good day, great day ahead.